Welcome to the Veritas Forum, engaging university students and faculty in discussions about life's hardest questions and the relevance of Jesus Christ to all of life.
Well, thank you very much for inviting me here. A really impressive group of people to talk with. I'm from North Carolina. I don't think you can tell by my accent, though. And I was happy to tell you, or maybe not, yeah, I guess I am happy to tell you that it's almost as cold in North Carolina today as it is in Hamilton. Never got above freezing. That freezing for us is 32 degrees Fahrenheit. So let me, whenever I give a medical talk, and I've given many medical talks over many years that I've been in psychiatry, the first thing you have to do is disclose whether you're supported by a pharmaceutical company or where you get your financial support, et cetera, or something about yourself. So I need to make a disclosure. So the disclosure is as follows. I'm a Christian, and I'm a psychiatrist. I was a Christian first. I've been in psychiatry over 45 years now, and throughout those 45 years, my faith has virtually not changed at all. And so I don't have an inspiring story of a dramatic conversion to talk with you about today. When I went into psychiatry, many people from my faith background said, "Oh, you're making a big mistake. When you go into psychiatry, you're going to have your faith challenged, and you may lose your faith." That never happened. That's a whole different story in terms of why that didn't happen. But suffice it to say, it didn't happen. And in fact, I became relatively well known in psychiatry. I basically know most of the leaders in psychiatry in North America. I know many of them very personally. They all know that I'm a Christian, and they've never really challenged me, and they've accepted me in a wonderful way. I feel quite at home in my profession as a Christian. So you might say, so where's the conflict? What's the issue? Why are you even here talking about the relationship between the brain and the soul and psychiatric disorders? Well, the conflict is a more subtle type of conflict. Before I went into psychiatry, I was a medical missionary in Africa for 2 years. And during that time, I read a book, and that book was written by a famous psychiatrist who lived many years ago, named Carl Jung. The title of the book was Modern Man in Search of a Soul. And as I was thinking about going into psychiatry, I began to wonder, what is it about soul that relates to emotional suffering? And so I've been thinking and working and trying to work through that question for a long time. And therein lies the conflict, because psychiatry has lost its soul. Just like Amanda said in terms of the book that I said, there is no soul in psychiatry today. It's brain, not soul. So that's really what I want to talk to you about today, is this loss of soul and how you put that and one's faith back into the experience of having a mental illness. Now, first of all, I'm a doctor. I have a son who's a doctor. He's a surgeon. But the types of problems we encounter are quite different. Now, he has someone who comes in and says, "My tummy hurts." And he examines it. He gets a scan of the abdomen, CT scan. He finds out there are gallstones in the gallbladder. He says, "You're having a gallbladder attack," and the person says, "Oh, I'm having a gallbladder attack." And then the answer is pretty clear. You go to surgery, and you have that problem corrected by having your gallbladder taken out. Pretty straightforward. Somebody comes to me as a psychiatrist and says, "I am really suffering." I don't say you're having a brain attack. And even if I said you're having a brain attack, the person who has that experience would not relate to the idea of brain attack at all. It's a suffering that's beyond anything that really can be described. The question that actually happens most of the time when this first happens to an individual is, what in the world is happening to me? The pain is so different that you have no idea who you should go to, if at all, in terms of seeking any type of professional help. That pain cuts to the very heart of who we are. It seems to disturb our faith. It disturbs our values. It disturbs our behavior. It disturbs our views of who we are, and we could go on and on. As I mentioned, you don't know who to turn to help you work out these issues. Now, what I want to do tonight for a few minutes is take you on a journey that I hope will help you to better understand what it's like and how soul and brain come together in terms of an individual who has a psychiatric disorders. And I'm going to do this throughout by using a fictional person, but this individual could easily be somebody in this room, or it could be somebody throughout the world. So this fictional person is John. John's a 22-year-old college student. What's happening with John? Well, over the past few months, his grades have dropped. He's having trouble concentrating. He's been drinking more alcohol, and he's actually had a couple of binges where he's not really known what he's done over a period of hours. That scared him, and so he's cut back on his drinking. He's sleeping poorly. He'll go to bed 1 or 2 o'clock in the morning, but then he wakes up at 6, and he can't go back to sleep again. But then the weekend comes, and he's sleeping 12 or 13 hours straight. He's put on weight, gained about 20 pounds. He's very stressed about what he's going to do with the rest of his life. He was a pre-med initially in college. He decided he did not want to be a doctor. He shifted his major to a business major, and he's working in that business major. But he is now 6 months from graduation, and he has no idea what he's going to do with that thing. In fact, he really can't see the future, and he actually has little motivation to see the future. He was in a 2-year relationship with another student. They were talking about getting married. Then the relationship broke up. He thought it was probably good that the relationship did break up, but in the process, this woman had actually provided him with virtually all of his social interactions. And so now he's feeling pretty isolated socially. He's even thought of ending his life. Now, his faith, he's a Christian, his faith basically has been a brake on that. It's not allowing him to do it. But he's had fleeting thoughts of maybe I could just take my car, start driving down the road 60, 70 miles an hour and just run into a bridge abutment. That way, I would be gone, and I wouldn't embarrass my parents or my friends because they would think it was an automobile accident. He's questioned his faith, even though he has a faith, and he's really asking the question, where is God when I need him? He really feels something that is not what we generally think of as being sad. He just feels an absolute profound emptiness. He says, I could care less if I win the lottery or if I break my leg. Says it really wouldn't make any difference. I just don't have much of a feeling for anything at all. He did seek some counseling on campus from a psychiatrist. The psychiatrist talked to him for about 20 minutes, prescribed a medication. Medication was Paxil. He took the medication for about a week, decided it wasn't doing him any good, and stopped taking it, and he's exactly where he was when we started. So now let's ask a question. The question is, does John have a psychiatric disorder? Yes, he does. He meets all the criteria for a condition we would call major depression. Next question is, does John have a brain disease? Well, he probably does have something that's not quite right in his brain. Symptoms that we think probably associated with this would be sleep problems, the loss of interest and pleasure in just about anything. Does he have other problems related to behavior? Yes, his drinking problem. Does he have too much stress in his life? Yes. He can't figure out what he's going to do when he graduates. Does he have a spiritual crisis? Yes. He really can't rely or is not gaining any benefit from his faith currently. So the answer to what John's problem is that all of the above. And so we might try to approach John's healing in 4 different ways, at least. We could do more, but 4. So we might approach it as a brain disorder. So if he has a brain disorder, then let's try to correct the brain disorder. We usually think of medications. We might think of some type of brain stimulation. We might think of some type of brain training. There are all sorts of things that psychiatrists and other healthcare professionals might do to try to help change John's brain. So that would be one approach. Second approach would be, well, he's got disordered thinking. So we're going to kind of take it one step sort of away from the brain and try to work on his thinking. And so we could suggest some type of what we call cognitive behavioral therapy, and there are many variations of this. The goal of these types of therapies is pretty simple. And that goal is, if John is thinking something is just not working out right, help change his thinking. I'll give you an example. Let's say John says, Fred is not a friend of mine anymore. And you ask John, why is he not a friend of yours anymore? Well, I called up Fred the other day and said, why don't we go out and just go out to eat somewhere? And Fred said, you know, I really would like to, but I've got something planned. I've got to study for a test tonight. And John says, Fred doesn't care for me anymore. So as a therapist, what I might say in that situation is, let's think about what's really happening here. Is it that Fred doesn't care about you, or that Fred has a test coming up? So he'd try to correct John's disordered thinking. So that'd be a second way we could try to help John. A third way we could say, well, John has got a problem being isolated. He's not around people as much as he once was. Let's try to do something to improve his social interactions. And so we invite John to a party or a social gathering, maybe to church or some other type of religious gathering. We do all of these things. And that's the way we're going to try to help John. Or we might say, John has a spiritual problem. And then we might say, well, if he just prays, reads scriptures, talks to a spiritual counselor, etc., that will correct John's problem. Now, interestingly, there is evidence that each one of these approaches could be beneficial for John. The problem is that most people will take one or two of these and think that's John's answer. And sometimes it actually might work. That is, you try one thing, maybe give a medication, and all these other things sort of just fall back into place. Or you might try some kind of talking therapy, and if you do that, then all these other things fall back into place. But many times, just approaching this in this, let's do this, or let's do this, that approach doesn't work. There's something missing here as we think about John. And this, quite honestly, is the thing that has troubled me throughout my practice as a psychiatrist. Diagnosing John's problem in this way and prescribing treatments in this way is sort of like the blind men who are trying to examine the elephant. I think some of you probably remember that old parable. There are 5 blind men, and they've got an elephant, and they're trying to figure out what this elephant is. So one touches the side, one touches the trunk, one touches the tail, one touches the tusk, and one touches the ear. And they begin to talk about it. And they're in total disagreement about what the problem actually is. One says, what we have here before us is a board. Another says, no, it's a tree trunk. Another says, no, it's a snake. Another says, no, it's a spear. And the other says, no, it's a piece of parchment. And so they can't agree. Well, the elephant, she knows, or she's thinking, I'm none of those things. I'm an elephant. I'm one thing. All of you are looking at me as if I'm made up of all these different pieces, when actually I am an elephant. John is saying, I'm not a broken brain. I'm not a disordered thinking person. I'm not a social isolate. I'm not a spiritual degenerate. I am suffering. I am suffering a problem, and nobody seems to understand this. But then you might ask the question, now let's get back again, but doesn't this all really start with the brain? You might see these other aspects, but doesn't it all really start with the brain? Isn't that where it begins? Well, if you think about it, if we are not conscious, that is unconscious, you would assume that none of these other things make any difference at all. If I'm unconscious, does social interaction make a difference? If I'm unconscious, does anybody care about my disordered thinking? If I'm unconscious, is anyone worried about sort of where I am spiritually? I can't even communicate. And so we might assume that since if we eliminate the brain's function by the person being unconscious, that then we actually have a situation where it is all brain. But let's be careful, because even though as we look at a person who is unconscious, we might not know what's happening with that person. There was a very popular book that I'm not sure I totally agree with, but I think gives us some insight into this. There was a neurosurgeon, Ibn Alexander, who wrote a book called Proof of Heaven. He went into an unconscious state. He says that the EEGs, that's the brain waves measures that they did, basically were flat. And yet he had the experience of going to heaven, seeing family members, etc. Then he eventually comes out of this, is profoundly affected by the experience, and writes it all up in a book. So now we don't know exactly what Ibn Alexander was experiencing, but from his perspective, he says, you thought I was unconscious, I was in heaven. That's what was happening to me. So we've got to be careful about saying somebody who appears to be unconscious that they in fact have no sense of what's going on. Our brains are sort of like computers. They're wired, and they can be wired in some situations in a way that do not work as well as we might like them to be. There are a couple of conditions that would be familiar to each of you. Schizophrenia might be one, autism might be another. But even there, if somebody is schizophrenic or if somebody has autism, does that mean that that's the whole story, that just this wiring of the brain is the whole thing? No, it doesn't mean that at all. The brain, we know, reacts to social stimuli. We used to think the brain was set. In other words, you got to be 18, 20, 25. All your neurons were there. They never went away until later in life, much later than anybody in this audience except me. You couldn't change them. All the connections were basically set down, and that was the end of the story. And we've learned that that's not the case at all. The brain is constantly changing. The connections are constantly changing. And things that happen outside of us, they may be social things such as going to school later in life, playing checkers or chess, playing video games. All of those things may be part of rewiring the brain. But now here's what's kind of interesting. There's also evidence that spiritual activity can change the brain as well. And so this hard wiring of the brain is not something that is truly hard. What in fact it is, it's more plastic. And the term we often use is the brain has a plasticity of its own. Now, if this was all brain, then we would think that there just ought to be something we can do to manipulate the brain, and then we could take care of all psychiatric disorders. And there are psychiatrists today who think just this way. And so they basically see themselves as brain doctors. And so they're looking for ways that the brain can be changed in one way or another. Now, I think that is a mistake, because I think when you just think of John as having a broken brain, you're not really hearing what John actually is. John has experienced something that doesn't reduce itself just to the brain. And John does not view his own problem as being only a brain problem. So let me give some examples of how John is thinking about this differently than the psychiatrist who might only want to prescribe a medication or stimulate the brain in some way. So the first thing, John is conscious, but he also knows that other people are conscious too. So John may be saying, I feel terrible. I wonder if everyone else or Jack feels just like I do. In other words, there's a term for this. It's called theory of mind. And the idea here is that we as humans not only think of ourselves as being a whole self, we think that others may be like us and may think and go through experiences similar to our own. That's totally outside this realm of just the broken brain. John also has a sense of continuity through time. Now, John says, I remember when I was in the 12th grade. That was 10 years ago. The molecules in John have almost been totally changed. In other words, what made up John 10 years ago isn't what makes up John now. But John has a sense that he is the same person, just older as he was when he was in the 6th grade. John also is searching for meaning. He's asking questions that don't just reduce themselves to the brain. Why is this happening to me? The answer, you have a broken brain, isn't a very good answer to that question. He says, what meaning is there for me in my life since I feel as terrible as I do now? Saying you have a broken brain is not enough to answer that question. John is also searching for something beyond himself. He's actually, in some ways, on the negative side of a quotation that was made over 1,500 years ago by a very famous Christian theologian named Augustine. It's one of my favorite sayings, and it says, restless is my heart until it finds rest in thee. John's looking for some comfort outside of himself. And telling John he has a broken brain just doesn't quite get that in the same way. This has been discussed for decades, centuries. A very famous psychologist in the United States over 100 years ago named William James called this a cosmic consciousness. Now that I don't think really totally captures what's happening, but the idea is that there's a sense there's something beyond me that I need to connect to. And that's, I think, a very important thing to keep that. And we're going to be talking more about this in just a moment. John knows how he's feeling and thinking, and the explanation that you have a broken brain is just not enough to help him. So we could ask another question. So what is it like for John to be depressed? We know he's depressed. We know what some of his symptoms are: sleep problems, not caring about anything, trouble with school, etc. But let's ask a different question. The question is, what is it like for John to be depressed? Now, there was a philosopher some years ago, not that many years ago, who wrote a paper that was an interesting paper called, What is it like to be a Bat? Now, his point was the following. He said, okay, let's take a bat brain and all the nerves in the bat, and let's work on that bat brain to the point that we understand everything about the bat brain. In other words, we've got all the parts identified. We have all the connections identified. We have all the connections that are active identified when the bat turns right or turns left or is going after an insect. In other words, we understand this bat's brain totally. This philosopher, Thomas Nagel, said, even if you know all of that, you don't know what it's like to be a bat. And so I would sort of put that forward and suggest that even though we know all of these symptoms about John, even though we may find some brain abnormalities with John, we can do scans with him, we can do other types of tests on his brain, we still don't know what it's like for John to be depressed. We cannot get inside John's head. That's something that's impossible for us to do. So that brings me to the question about soul. As I said, this is sort of where I started on my own journey, and I'm still on this journey trying to understand this better. And so let me tell you where I am with this. Many years ago, I taught a Bible school class, and the class was on soul and spirit. And I basically taught that the soul and the spirit were separate from the body. And the soul and the spirit, which went to heaven after one died, and the body just kind of decayed. And I now believe that I was totally wrong. That was not what's really happening. Soul is very difficult to define, but it's not just brain. There's a term we use that I sort of like to use, and I think this helps describe it, is that the soul supervenes on the brain. That's a big word, but it simply means that you have to have a brain in order to have a soul, but you can't reduce the soul back to the brain. It's something that is above and beyond the brain. And I think there's some evidence for this in some discussion that the Apostle Paul makes in the book of 1 Corinthians. He talks about the resurrection of the body. Now, it's always been kind of a curious thing. Why is resurrection of the body, if you believe in resurrection, why not just resurrect the soul? Resurrection of the body is very important. I think we're not whole. We don't have a total soul unless we have both body and brain working together and soul supervened on top of that. I think that's what resurrection will be like for those of us who believe in resurrection. Now, there's another way that this can be looked at. Plato, the famous philosopher, thought that soul basically was separate and apart from our physical bodies. And he would be sort of like our modern psychiatrist, because what he would probably say is that a psychiatric disorder is basically a body disorder. It has nothing to do with the soul. The soul may be affected by it, but it's not the soul that's the problem. He would say that bodily humors might be it. And humors, he might say that a person who has a melancholy or black humor in the body actually is someone who's subjective to depression. But I think Plato, from my perspective, has really been proven wrong in this. So let's go another step and ask the question, so what is mental health? Now, John wants to be returned to mental health. So the question is, what is mental health? What is this thing John wants to get back to? And psychiatrists and secular individuals and Christians have been trying to answer this question for years and years and years. We've got many, many more definitions. We've got textbook after textbook that's been written on what goes wrong in terms of our emotions and our thinking, etc., our memory. But there are not many that tell us much about what does it look like if things are going well. Sigmund Freud, who was a very famous psychiatrist over 100 years ago, who wrote volumes about all the problems individuals had, was asked once, what is mental health? And he said 5 words: to love and to work. That's it. Some other individuals have expanded that somewhat, and this could be something that both religious individuals and secular individuals, non-religious individuals, could agree upon. Mental health would be to make the most of your potential. It could be to cope with life, resiliency. It could be play a full part in your family, workplace, community, and among friends. It could be grow in wisdom and in knowledge. Now, that's a perfectly legitimate question, but it seems like this somehow still is leaving things empty. So I'm going to suggest to you that mental health involves soul, and soul involves wholeness, bringing all these things together. That's what soul is. It's bringing us together within ourselves and bringing us into relationships with others and into relationships with a higher being. That's what I think soul is. Now, you might say, okay, if you're a psychiatrist, should that really make a difference? And I'm going to suggest to you that it does. You may not even be a believing psychiatrist. You may be an atheist. You may be a materialist. But listen to the individual in front of you. And the person who's talking with you is talking about things that just don't reduce to a broken brain. And individuals with whom you're talking as a psychiatrist cannot be satisfied. And so in some ways, psychiatrists, even non-believing psychiatrists, need to attend to soul and need to attend to spirit and spiritual issues, because that's what people are talking about. We're never going to be able to totally help John unless we accept that John is all of these things in one, and we have to address them all in a way. So how are we going to help John? Well, I think he probably could benefit from medication. He needs to take it a little bit longer. It needs to be watched well. I think he could benefit from some talk therapy. He needs somebody to maybe help him think through ways in which he can do what he's doing better. He could certainly benefit from being given a little shove out to be more socially active. But I think what John really needs to kind of tie all this together is what I'm just going to call soul talk. He needs to be able to talk to someone, doesn't have to be a therapist. He needs to talk to someone who really listens to him and appreciates him in his fullness and in the fullness of the suffering which he is experiencing. That's what John needs. It's someone who recognizes that John is more than just these parts that we've been talking about before. He doesn't need a cheerleader. He needs someone to talk and listen. So then the final question I want to leave with you is, how are we going to know when John is mentally healthy? How are we going to know when he has been healed, his soul has been healed? Now I'm just going to suggest some things that we're going to see in him that I believe will suggest he is, in fact, healed. It's not when he is totally happy. It's not when he faces no problems. It's not when he finds a new girlfriend. It's not when he starts attending a religious service. None of those. That's not the answer. These are some answers that I'm going to suggest to you. We're going to know John is doing better when he accepts who he is with his weaknesses as well as strengths, when he accepts his past as well as where he is now. We're going to know John is better when he accepts that he could become depressed in the future. This could happen to him again. And yet, he has hope that he can get through that period when he feels so down. John is going to be better when he can cry for himself and others. Remember, John couldn't cry. He couldn't feel. So John's going to be mentally healthy when he can cry. John's going to be healthy and better when he adapts to days when he is down. He's going to have down days, and he needs to recognize that he's going to have down days and just realize there will be ups and downs, and he can get through that. John's going to be healthy when he finds pleasure and satisfaction in his school work, and I'm saying school work here because he's in school. But I sort of like Freud think, mental health has to do with being happy in your work. We are born to work. I actually wrote a book on that many years ago. We are born to work. And so it can be work in many, many different aspects. It may be work for pay. It may not be work for pay. The point is we're born to work. We're born to do something or accomplish something. John will feel better when he's doing that. John's going to feel better when he has fun. One question I often ask individuals is, do you have fun doing anything? And when I'm asking a depressed person that, they often will just say, nothing. And then I keep digging, and I might find something where they're having pleasure, such as, I really can sort of forget myself, forget my problems when I'm out throwing the Frisbee. I can really forget myself and forget my problems when I'm canoeing. Who knows what it might be. But that's something that I look for as a cue that this is something I want to work on and encourage. We'll know John is getting better when he no longer feels the emptiness that is beyond tears and grief. We'll know John is getting better when he sees a future. John basically sees no future currently. When John can see a future, even though it may not be, he may know exactly what's happening, but he does think, I'm going to still be around here 5 years, and I need to begin to think about what I'm going to do over the next 5 years or so. We'll know John is better. We'll know John is better when he develops friends. Now, John's probably never going to be a social butterfly. He's not going to just be forming one relationship after another. But we'll know he's better when he begins to form friends. We'll know he's better when he develops a more confident sense in the other. And in this case, I think with God. Something beyond him, something he can rely, something, some person he can rely on. Someone who helps him fit the bigger picture into his overall picture of who he is. He's going to be better then. I like the expression, though I don't understand the philosophy totally. Martin Buber, a well-known Jewish philosopher, talked about I-thou relationships. And it's a relationship where you feel connected to something, really connected, that is beyond you. And he was talking about God. And John will know John is better when he embraces his responsibility. So those will be signs that John is better. Beginning again, John has soul. And we can't get in John's head to know exactly what that soul is. So we may never know, but only John will know. I'll end up with one story. As Amanda mentioned, I work with older people, and I had an older patient who had a very severe depression. We treated him. He got better, but I was never convinced he really had totally healed. And so he had been a golfer in the past. And he would come in, and I kept asking him what he was doing. He had not gone back to playing golf. I never encouraged him to go play golf, but I knew that may be a marker. And we kept going. This went over about a year. And after about a year, he came in, and he had a smile on his face, and he said, I'm golfing now. And I says, what does that mean? And he said, I'm well. So John will be the person who will know when he's well. Not a doctor, not a spiritual counselor, not a social worker. It will be John who will know. So thank you very much, and I'll be glad to answer any questions that you have.
The question is, if I have a friend that I suspect has mental health issues, how do I bring it up to them? Because I want them to get better and find help without freaking them out more.
Well, I think the the most important thing to do with a friend who you think has some mental health problems is to solidify your friendship and get them to talk. And then begin, maybe ask them questions. What do you think you should do? And the person may just feel so bad that they say, I don't know what to do. And then you can, in that situation, when you have a relationship and they basically say, I don't know what to do, you might suggest, have you thought about getting help? The person may say yes or no. Often they will say yes. Rather than telling them, well, you need to go to the counselor, say, where have you thought about getting help? What kind of help do you think would help you? So sort of follow their questions. Try to follow them along as far as you can before just saying, you need to do this or you need to do that. And often that means you've got a partnership, and also it would be helpful. You might say, well, I'll be glad to go with you the first time you go to a counselor or you go to someone who's going to help you. So that personal relationship becomes very, very important. So clearly, don't break the relationship. That's what you want to keep from doing. So other questions or comments? I cannot believe Canadians are shy. Okay. Okay. So, what if I feel the same emptiness John feels, but I'm a functioning member of society? Is that a problem? I'm not going to sit here and try to diagnose based on 3 lines of a text, but what I would say is, yes, I do think that can be a problem. People who are pretty profoundly depressed can still function, especially people who are used to functioning highly. So I think if you feel that emptiness, if you just feel flat, if you get up in the morning and you just say, oh, another day, I'll get through it, but I'm just not looking forward to anything today, and you just are going through the motions, and because you are high functioning, you go through them very well, yes, in that case, you probably could use some help. I would say that's a key suggestion of depression. Okay. Other questions? Okay. Got another text? Okay. All right. The question here is, how do you know when to handle depression on your own or when to ask for help? When you try to overcome it on your own, and after two signs. Number one, if you go for weeks and it's not getting better, then you need help. But the other sign is if you really get to the point that you just think it's not worth going on, you need help. Because that thing we obviously are most concerned about is suicide in individuals who are depressed. And when you start thinking suicide, and you may be thinking about specific ways to commit suicide, that's a very real problem, and you need help at that particular time. Someone else? Okay, we got questions coming now. Is there anyone who won't benefit from seeing a counselor? Yes, there clearly are. If you force somebody to go to a counselor and they're fighting you tooth and nail every step of the way, that's probably not going to work at all. And probably one of the best examples of that, and something I suspect you see frequently here on a college campus, are individuals who have eating disorders. They absolutely refuse to get help for that eating disorder. Those are individuals who just having them go to a counselor probably is not going to do it. It almost takes sort of a full court press to really help those individuals break the cycle of their eating disorder. And so just having them go to a counselor, they may even go more than once, but that's probably not going to help them. Okay? You may just want to stand here. Okay. How can the church be a better support system for people with mental health issues? This is a long discussion, but I'll try to as short as I can. The first thing the church needs to do is to understand mental illness and what it is. And the church needs to understand the unique role of a person's faith and a person's spirit and a person's soul as it relates to mental illness. I want to go back to something that I said very early on, and that is when you have a gallbladder attack, you say, I'm having a gallbladder attack. But when you're having a mental illness, you say, I'm hurting. I am hurting. And when the church says, oh, you've got depression, you need to go see a doctor, that doesn't help. When the church can get around that individual and say, we see your suffering, we hear your suffering, we're going to walk with you through this process, and that requires an understanding of what psychiatric disorders are, mental health problems are, then I think that is a very important way for the church to do this. Second way the church can be very helpful in these situations is to know who are the competent individuals in the community who are professionals who are willing to work with people of faith without thinking they have to challenge their faith. And so getting a group, a list together of who those persons are is very important. And good churches actually do this. They've got lists of competent individuals. They know to whom they can refer, and they can help the person get to see the right people. But if the church only is referring out, that's a mistake. It needs to be a partnership. In the church I attend, we have a wonderful associate pastor who has some training in counseling. He also has a wonderful network of counselors around the city of Raleigh. And what he does is he will refer out, but he continues to keep up with these individuals who have problems. And so it's a partnership. And the professional counselors in the community know him, he knows them, and they're together working with the person who's suffering. So that, I think, can be a very important way to do this. Got another one? Okay, do you find that it's hard as a Christian psychiatrist not to impose your beliefs toward your clients? Where do you draw the line? Well, this has been an issue that has been around for quite some time now. I don't think it's the role of a psychiatrist to impose one's belief. But I live in North Carolina, and virtually everyone in North Carolina comes from a religious background. And so what I try to do in that situation is to call upon their beliefs and work with them through their beliefs. Now, sometimes you will come into a conflict. And one of the conflicts that I come into, not that often, but I've come into it before, is around the issue of homosexuality. And I believe homosexual behavior is not right. And people who know me know that to be the case. I don't try to change individuals who have a homosexual orientation. And if they need help and they feel that they don't want to try to control their homosexual tendencies, I will just refer them to somebody else. And so I feel professionally that's what I need to do. Everyone at Duke, where I am, knows exactly what my views are, and they know exactly how I'll manage a situation. And so they'll sometimes refer somebody who's struggling, and I'll work with them for a period of time. But I think as a professional, I think you've got to be very careful about imposing your faith. However, as I said, I work with people who, for the most part, have a faith. It may be buried. It may be superficial, but there's a faith there nevertheless. And given the fact that there is a faith there, then I can often work with that as I work with them. Now, the interesting thing for me is that I'm known as a Christian psychiatrist in the community, and individuals will come to me with a problem. The first question they have is, are you a Christian? And I will say, yes, I am. And that's initially the last thing that they want to talk about after that. And once I've gotten this brand of you're a Christian psychiatrist, I'm a Christian, now let's get on to business. And the business has nothing to do with faith. And so I find myself having to kind of bring the faith issues back in, because the fact that they view me as being safe is sort of as far as they really want to go. And that can be problematic. Question here. Is it possible that mental illness is the result of demonic experience, or that attacks or skews with individuals' mental health? Well, this is an area that is beyond my expertise for certain. But what I will say is that I have seen, on rare occasions, but I have seen situations in my practice where I said, this is beyond anything that I can explain on the basis of what I've learned in psychiatry. And I still remember a particular case where they brought a young man in the emergency room. I was a resident at the time, many years ago. Brought a young man into the emergency room, and they didn't say, he's agitated. They didn't say he's seeing things or hearing voices, etc. They said, there's something really strange going on here. And it turned out he was about 5'3", weighed about 100 pounds, and it took 6 policemen to control him. And so they got him into the ER. I examined him. We sent him to the state hospital in our area, where they treated him with massive doses of antipsychotic medications, which basically would have almost sedated an elephant, and didn't do hardly anything at all. His family finally came and said, we live on a farm up in eastern North Carolina, and let's just take him there. And then we heard back later from the family, who said he just spends his days roaming around in the woods. And he says he has this thing that he calls sort of his idol, and he carries it around with him all the time. So he'll come in and eat occasionally, and that's it. So there's a situation where, I have no specific diagnosis for what's going on with him. He was extremely unusual. And so I guess the message for me was, there's some things I just may not understand that are going on in the world. And so I don't just automatically say there are no demons, because I've seen situations where it's beyond my level of expertise to deal with. That's been rare. It's very rare, but I have seen it. Someone else. Okay. How can one who doesn't have many close friends deal with depression? It's a good question. Well, I think first, hopefully seek some help. But I think one thing a good therapist will do is try to help you begin to form relationships. And another area is try to help you to learn in those relationships how you can appropriately interact in such a way that you can build relationships. There actually is a specific kind of therapy that's used. It's called interpersonal therapy, which is a therapy for depression. And the approach to therapy is you can begin to break the cycle of depression by trying to, by getting into sort of how you relate to individuals, and really going through an educational process of relating to individuals in a different way. And that, in turn, is a way that you might be able to break that cycle. So there are some therapies out there. So I think some specific help in terms of how you deal with relationships, and then sort of the little nudge out the door to try to get into relationships, and then coming back and talking about what happened as you interacted with these people. It's really learning how to interact. Another question. That's okay. Fine. Now I'm back home. Okay. I'm very.
Thank you very much. I appreciated when you brought in the concept of theory of mind and continuity through time, because you gave it a nice balance of not making it too technical with those psychology concepts. I'm hoping you can give the same treatment to a couple of other concepts that I'm curious about, like self-efficacy and locus of control. And also just a shout out to everybody else in the room. I really appreciate Dr. Blazer coming here, but there's other resources on campus. If you feel you're questioning your sexuality and your intuition tells you that you're not wrong, there's other resources here at McMaster that anyone can get a hold of, and I'll talk to them about it after. Okay? So I just wanted to put that out there, and thank you again.
Thank you for saying what you said. Yes, I'm leaving tomorrow, so I'm gone. Self-efficacy is an interesting concept. It basically has to do with, I think, a feeling that you put into action that you actually can control and change the situation. So it's maybe I probably do better with using an example. So, for example, an individual who is self-efficacious is an individual who, let's say, has taken a test in a class, and they get the test back, they have a poor grade. They have two questions. One question is, I think they may have graded my test wrong, but the second question is, if this really is right and I'm doing this poorly in the class, how do I get better? Self-efficacy would come into play when that individual knows how to approach the professor, to phrase the question and the inquiry in such a way that you don't turn the professor off immediately, and you open a door that allows you to get better. And it's the confidence that you have that you actually can do that. In other words, you can make a difference. So my understanding is that's sort of what self-efficacy actually is. Locus of control is a somewhat different situation. This is where, are you in control, or is everything else, are you totally out of control? Let's putting it the two extreme examples. Now, I work with older people, and a place that this comes up frequently is in the area of individuals who are in nursing homes, where in reality, individuals feel almost totally out of control. I mean, everything they do every day seems to be controlled by somebody else. And so the question is, if someone feels that they're losing, who always has been an individual who has been in control, and yet they feel that they're out of, how do you manage that particular situation? And so there are ways that can be done. And so it may be that if you have an internal locus of control, if you feel like you need to be in control, you find something that you can control. It actually may be something as simple as having a plant in your room that you water and you keep alive. It can be that simple. But it's finding something that you can do where you feel like you're in control, and this depends upon you. And so there are scales that are out there, and you could actually figure out where you fall on the locus of control spectrum. You either sort of feel like that you're out of control and you basically sort of go with the flow in terms of what's happening, or you feel like you are in control and you have to make things happen. And most people will fall somewhere along that scale, not at one of the ends. Hope that is close.
Do you think those things would have helped John?
I don't know. That's a good question. I think certainly John, at this point in the midst of his depression, is certainly at the end of feeling he's totally out of control. I don't know that would be the first place I would start with John, but I think along the way, I think that issue would come up. Say, John, you're graduating soon. You're gonna, what are you going to do now? You need to take charge of that area of your life. And so kind of moving him toward more control around that particular decision might be a good way for John to work. Okay? All right. Other questions? Anyone? Okay, good.
Maybe one more question.
Okay.
The last one.
All right. What would you recommend for a friend who recognizes they have a problem but refuses to see a doctor or take medication? Okay, this is the common thing. And I think a lot of this has to do with the fact that psychiatric problems or mental illness is embarrassing. There's a sense that there's nothing that can be done, and there's a distrust of the people who are trying to that might be able to help in that situation. So I think what you have to do with the friend is begin to break down those barriers. So you have to say, one, what you're going through is not totally, other people have gone through this before. There are people out there who I think could help you, but you have to trust them, and that will be hard for you when you do it. Now, the medication issue is sort of an interesting one. If you had asked me that question 30 years ago, I would have said this is one of the greatest problems that mental health professionals face because people do not believe drugs will make a difference or can be of help. In 2016, it's sort of rare to find somebody who doesn't think a drug will work. In the United States, something like 12 to 15% of individuals take antidepressant medications. far more than probably need them. We're in a society where we believe drugs are going to relieve everything. One of the biggest problems we have in the United States is overdose on opioids. Drugs will help everything. So it's somewhat unusual these days, quite honestly, to run into people who say drugs, I'm concerned about the medications. If you encounter that, though, you don't just say the drugs will help, because they may or they may not. Our psychiatric drugs are reasonably good, but they're far from perfect. And so we have to be honest about whether they'll work or not. And one of the things we have to do is say, if it doesn't work, we'll just stop it. We'll see. Give it a try. Thankfully, most of the drugs we use today are relatively safe. And so getting that message across, let's give it a try. They're relatively safe, and we'll find out whether it works or not. It's probably the best thing to do. Listen, thank you very much. You've been a very patient group of individuals, and I really appreciate being here with you.
For more information about the Veritas Forum, including additional recordings and a calendar of upcoming events, please visit our website at veritas.org.